Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here once again with Doctor Zahra Figueredo. How are you, doctor?
Very good, Luis. Thank you so much. How are you?
I'm doing great. It's a
Good.
beautiful day out there.
Beautiful. And great to be with you today.
So we are gonna talk today about the stem cell treatment for the side effects of COVID. Is that correct, doctor?
Side effects of COVID vaccine.
COVID vaccine.
That's right.
That is this should be a very interesting podcast. You cannot miss this one.
Very. It's because I think that the side effects of post-COVID are pretty well known, I think, by now. And yet we're still discovering things. But I think that what's less spoken about is post-vax syndrome, as they call it. So the symptoms and side effects of the vaccine, unfortunately.
Yeah, I think we actually know just a little about the vaccines. I'm sure there are a lot of studies and we have different views from one side and the other. But I'm pretty sure there's like a clear gap about all the research that is available right now for all the symptoms and the vaccine, right?
True, very much so. And we're just now becoming aware of these symptoms more and more, and as they relate to the vaccine, and so it's just now coming to light, and we have addressed it with several patients with stem cells and the other modalities that we offer.
Can you mention some of those symptoms, doctor?
Mm-hmm. So everything from exercise intolerance, of course, that brain fog, the heat intolerance, sometimes cold intolerance. There's also cardiac issues, as well as cognitive slowing and memory issues, extreme fatigue, which has been a big one with a lot of patients, as well as tinnitus, neuropathies, various different conditions that we see with a lot of patients.
Is there any at the moment any prescription that can that we can take for these type of symptoms? Or?
Some doctors are prescribing beta blockers, ivermectin, steroids, all in combating just the symptoms. It doesn't get to the root cause. We here at the Stem Cell Healing Institute are really, really keen on getting to the root cause of the problem. And in many cases with COVID and post-COVID vaccine syndrome, there's also a clotting issue. We see this, and basically it ends up causing microclots or clotting that affects circulation. It affects in some cases even to some degree decreased neuroplasticity, organ tissue damage. We see that with COVID, and because the vaccine works similarly in sort of introducing to the system, exposing the body to the antigens of the virus itself, the same response happens with the vaccine as would with COVID itself. So we see a lot of these symptoms overlapping, the symptoms of COVID itself as well as the vaccine. And so in combating these symptoms, we want to get to the root cause, which is a big cause is the circulation problem, the damage to nerves and neuropathy. There was another symptom as well as tinnitus, which can result from all of this as well. So getting to the root cause is extremely important in addressing the symptoms.
So how do we better understand all these effects of post-vaccine symptoms, long-vax symptoms?
How do we...
The effects?
I think that time is a big factor here in seeing the long-term effects and how it's affecting an individual. I think that in so many cases, not only is it physical, obviously, with the fatigue and with along with the other symptoms, it takes a psychological toll as well. And people just are finding that the quality of life is diminished because they're just not as tolerant to perhaps the amount of work that they used to do, or exercise, or focusing and cognitive issues, the peripheral neuropathies that happen. So we see not only the physical aspect of the deterioration, but also the psychological and emotional, which is really, really important in addressing as well.
Is there any research done as far as the stem cells working against all these post-vaccine symptoms?
Yes, I'm glad you asked me that, Luis, because we have seen with our experience with post COVID as well as post vaccine treatments with stem cells is that we are looking to modulate the immune system because we see extensive inflammation with both of these, with COVID itself as well as the post vax. So we want to modulate the immune system by modulating inflammation and stimulating regeneration with the stem cells, which they do, and renew the tissues that have been damaged. That's the main mechanism here. And combining the way we do at the Stem Cell Healing Institute, the exosomes themselves from the stem cells, the exosomes have found to have antiviral activity as well, preventing the virus from actually replicating. So we have this sort of compounded effect of the regeneration from the stem cells, the inhibition of replication of the virus itself, anti-inflammatory and immunomodulatory effects, which in combination has been very, very effective.
So we already know that COVID can affect our emotional well-being. Can also the post-vaccine affect that?
Absolutely, absolutely. So, really with any disease condition that is so, right, that's so debilitating, we see it taking a toll on the patient's psyche, taking a toll on the patient's mental, emotional, spiritual, psychological well-being. And so and just because the quality of life is diminished so much. So it's really important that we address these aspects of healing as well, which is really important to us at the Stem Cell Healing Institute.
And in this case, doctor, is there any specific stem cells that you use for treating post-vaccine patients?
Yes, thank you for asking that, because that's a very important question. So in this case, we use a combination of autologous, usually mostly bone marrow derived, because we have a proprietary method of growing brand new, young, non-toxic stem cells in extremely high numbers, unprecedented numbers. And we like to combine this with endometrial stem cells, which are allogenic, very carefully screened. And the reason why we do this is because endometrial stem cells have specifically shown very, very high activity for not only anti-inflammatory effects, as do autologous stem cells as well, bone marrow stem cells, but also the immunomodulatory effects that can arise from post-vax syndrome. So to augment all of this is really important. So as we say at the Stem Cell Healing Institute, we leave no stones unturned. And so we will use everything possible for the best possible outcome and the well-being of the patient.
Can also the detox problem can work for this or not?
Yes. So that is such a good point, Louise, because the vaccine essentially can be seen as a toxin. And because it is foreign to our bodies, that is why we actually mount an immune response, because there are foreign particles from the virus itself that are exposed to our immune system. So the toxic effect of the vaccine itself, because we are mounting this immunomodulatory, this immune response to the toxins, the antigens per se, we want to also undo any further toxicity that is inhibiting and diminishing our system. So the detoxification aspect of our program and of our treatment is extremely, extremely important, especially with the vaccine. And not only do we see the toxic effects of those particles, the antigenic particles that are exposed to the system, but also the other ingredients of the vaccine that are very, very questionable and can be very controversial as well.
I am going to put you on the spot with this question, doctor. Did you vaccinate it? Are you vaccinated?
Yes. Yes, in my opinion, and I respect the opinions of everyone, I did not want to get vaccinated. However, I was forced to as a medical professional, and absolutely, I'm vaccinated, and I had to undo it with all of my my own treatments. So the detox program, the stem cells, everything I possibly could, my diet and supplementation as well, which is what we do with our patients as well.
So the next question will be: do you feel different since you have done all these treatments to yourself?
Thank you for asking that. That is a really, really important question because I have done all of these post-vax, trying to undo everything I possibly can post-vax. I feel very good. I feel okay, and it's probably I'm probably biased, but absolutely. I had stem cell treatments, IV with mannitol, intranasal aspiration, intrathecal. I continue to do detoxing, as well as my diet has always been clean. My supplementation has always been clean. Of course, I'm not a manic. I do enjoy certain key vices.
A hamburger.
Absolutely.
Every time and then.
Every now and then.
Every now and then.
Absolutely. And I condone, moderation in my patients. I think it's really important because life is short and we're not perfect as humans. And that's okay. So yes, I do try to live a low toxic lifestyle. And personally, I don't drink or even take any kind of prescription medication. I would strongly urge patients, especially patients coming for stem cell treatment, to abstain from alcohol, and we can discuss other things further. But that's a really big one.
Sure. And in case you have any questions for Dr. Figueredo, by the end of this podcast, you will find all the information regarding, of course, the stem cells and all the treatments that she does here in Guatemala City. Anything else you would like to add, doctor?
No, I think we've covered a lot of ground. Maybe just quickly to touch base on our pre-treatment, which includes the total detox program of a nutritional IV with very high antioxidants and nutrients and trace minerals. We follow that up with coffee and antioxidant suppository, as well as B vitamin shots, exercise with oxygen or hyperbaric oxygen, as well as growth hormone therapy and a stem cell, proprietary personalized stem cell enhancement formula, as well as addressing psychological, emotional, and even spiritual aspects of healing. So all of that is, as I mentioned earlier, so important in the stem cell treatment as well as healing the body. So I wanted to leave by mentioning those things ultimately.
All right, doctor, we appreciate your time, and I will see you next week for the next podcast.
Thank you so much, Luis. Always a pleasure.
You take care, doctor.
You too.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.